Good day! We are the Group 4 and we are going to discuss our output in Worksheet 6 that's all about the nervous system and special senses. So I am Crisame F. Lardera and I am the group leader for this group. And to begin, let's start with the first part that will be discussed by Miss Rebecca Gale Malagrosa.
Good day, everyone. I am Rebecca Gale Milagrosa, and for today, we are going to talk about the nervous system and the special senses. For the first part, the neuron anatomy and physiology. Number 1. The cellular unit of the nervous system is the neuron. What is the major function of this cell type? Neurons, also called as neurona or nerve cells, are the fundamental units of the brain and nervous system. The cells responsible for receiving sensory input from the external world, for sending motor commands to the muscles, and for transforming and relaying the electrical signals at every step in between. Number 2. The supporting cells or neuroglia have numerous functions. Name 3. Number 1. Astrocytes. Abundant star-shaped cells that account for nearly half of neural tissue. Number 2. Microglial cells are phagocytes that defend CNS cells. Number 3. Ependymal cells lines cerebrospinal fluid-filled cavities. Number 3. Match each statement with the response chosen from the key. Number 1. The brain and spinal cord collectivity is the central nervous system. Number 2. A tiny gap that separates two neurons, synapse. Number 3. A collection of nerve cell bodies found outside the central nervous system, the ganglion. Number 4. Neurons connecting sensory and motor neurons, interneuron. Number 5. Neurons process running through the CNS, tract. Number 6. Collection of nerve cell bodies inside the CNS, the nuclei. Number 7. Neurons that conducts impulses away from the CNS to muscle and glands, the efferent neuron. Number 8. Neuron that conducts impulses towards the CNS from the body periphery, the afferent neuron. Number 9. Chemicals released by axon terminals are neurotransmitters. And number 10, specialized supporting cells of the nervous system, neuroglia. Number 4, draw a typical neuron and label the structures. We have here the dendrites, the stoma or the cell body, the nucleus, the node of Ranvier, the myelin sheath, the axon, and the axon terminal. Next part. Number 5. How is one-way conduction at synapses ensured? Signals arriving at a synapse cause excitation of nearby nerve or muscle, but activity around a synapse can never trigger a nerve impulse traveling back towards the cell body. Once a critical level of excitation is reached, a wave is created traveling down the axon, with each part of the axon stimulating the next. The traveling wave is called an action potential. An action potential traveling down an axon is always the same strength. This is known as the all or none principle. The nerve either is transmitting an action potential or it is not. And every action potential is the same size. This means that it is the frequency of action potentials which is key for encoding information such as how forcefully a muscle should contract. Number 6. What anatomical characteristics determines whether a particular neuron is classified as unipolar, bipolar, or multipolar? Unipolar neurons have a single short process that emerges from the cell body and divides T-like into proximal and distal branches. Bipolar neurons have two processes, an axon and a dendrite, that extend from opposite ends of the soma. The multipolar neurons are the most common type and have one axon and two more two or more dendrites. So we have here the unipolar neuron, the bipolar neuron, and the multipolar neuron. Number 7. Describe how the Schwann cells from the myelin sheath and the neurolemma encasing an axon. Neurolemmas are sometimes called a sheath of Schwann or Schwann's sheath because they are the outer layer or covering of Schwann cells. Schwann cells are the main glial cells of the peripheral nervous system, or the PNS. The neurolemma, as the outermost layer, serves as a protective function for peripheral nerve fibers. Schwann cells are either myelinating or non-myelinating. Myelinating Schwann cells form around the axons of sensory and motor neurons to form the myelin sheath. Number 8. Correctly identify the sensory, afferent, neuron, interneuron, and motor neuron in the figure below. Which of these neuron types is or are unipolar? The sensory neuron or the afferent neuron? Which is or are most likely multipolar? The motor neuron or the afferent neuron? Number 9. The structure of a nerve. So, what is a nerve? We have here a diagram of the parts of the nerve. The sensory or the afferent neuron, the interneuron or the association neuron, the receptors or the thermal and pain in the skin, motor or afferent neuron, and the effector or biceps brachii muscle. So, that's all for the first part of the reporting. I am Rebecca Gail Milagrosa. Next reporter, please.
Thank you for that, Miss Rebecca. Again, I am Crisame F. Flordera, and I am the second presenter for our group. So, I will be the one who will be discussing about the nerve impulse. So, let's start with the number 13, which is the matching type. So, number 1, reversal of the resting potential resulting from an influx of sodium ions. Our answer is the depolarization. Number 2, period during which potassium ions are diffusing out of the neuron. Our answer is the repolarization. Number 3, transmission of the depolarization wave along the neural membrane. Our answer is the action potential. Number 4, mechanism that restores the resting membrane voltage and intracellular ionic concentrations. Our answer is the sodium-potassium pump. So now let's proceed with the number 14. Would a substance that decreases membrane permeability to sodium increase or decrease the probability of generating a nerve impulse? So our answer is a substance that decreases the membrane's permeability to sodium will decrease the probability of generating a nerve impulse. Number 15. Why don't the terms depolarization and action potential mean the same thing? Our answer is a depolarization is any change in neuron that makes it more positive than resting potential. But an action potential only occurs when the depolarization reaches the threshold level. So that's all for the nerve impulse. So let's start with the number 1. In which of the cerebral lobes, frontal, parietal, occipital, or temporal, would the following functional areas be found? So for the first is the auditory area. Our answer is in the temporal. Next is the primary motor area. Our answer is frontal. Next is somatic motor area. Our answer is parietal. Olfactory area. Our answer is temporal. Visual area. Our answer is occipital. And lastly is the Broca's area. Our answer is frontal. So for the number 2, match the letters on the diagram of the human brain. the or on the right lateral view to the appropriate terms listed at the left. So for the number 1, the frontal lobe, our answer is H, or in the H part. So number 2 is the parietal lobe. Our answer is B. Number 3 is temporal lobe. Our answer is J. Number 4 is the precentral gyrus. Our answer is F. Number 5 is the parieto-occipital sulcus. Our answer is C. Number 6 is the postcentral gyrus. Our answer is A. Number 7, lateral sulcus. Our answer is I. Number 8 is central sulcus. Our answer is G. Number 9, cerebellum. Our answer is E. Number 10, medulla oblongata. Our answer is L. Number 11 is the occipital lobe. Our answer is D. And for the number 12, for the number 12 is bones. Our answer is K. So number 3, which of the following structure are not part of the brain stem? Circle the appropriate response or responses. So our answer is the cerebral hemispheres and the cerebellum. So let's proceed with the number 4. So for the number 4, it says that complete the following statements by writing the proper word or phrase in the corresponding blank at the right. So for the number 1, unblank or the ancirus is an elevated ridge of cerebral tissue. Inward folds of cerebral tissue are called sulci or tissues. Gray matter is composed of neuron cell bodies. White matter is composed of axons, a bundle of fibers that provides for communication between different parts of the CNS is called amylated fibers, whereas one that carries impulses between the periphery and CNS areas is called an basal cells. Nuclei deep within the cerebral hemispheres, white matter, are collectively called the nerves. And now let's proceed with the number 5. So for the number 5, it says that identify the structures on the following sagittal view of the human brain by matching the lettered areas to the proper terms at the left. So for the number 1, cerebellum, our answer is P. Number 2, cerebral aqueduct, our answer is M. Number 3, cerebral hemisphere, our answer is A. Number 4, cerebral peduncle, our answer is L. Number 5, choroid plexus, our answer is H. Number 6 is corpora quadrigemina, our answer is K. Number 7, corpus callosum, our answer is B. Number 8 is fourth ventricle, our answer is N. Number 9, hypothalamus, our answer is D. Number 10, mammillary bodies, our answer is F. Number 11, intermediate mass, our answer is C. 12, medulla oblongata, our answer is Q. 13, optic chiasma, our answer is E. 14 is pineal gland, our answer is J. Next is number 15, the pituitary gland, our answer is G. Number 16, pons, our answer is O. And 17, thalamus, our answer is I. So next is the number 6. So number 6 says that using the anatomical terms from item 5, match the appropriate structure with the following descriptions. So for number 1, site of regulation of body temperature and water balance, most important autonomic center of brain. Our answer is the hypothalamus. Number 2, located in the midbrain, contains reflex centers for vision and hearing. Our answer is corpora quadrigemina. Number 3 is coordinates complex muscular movements. Our answer is cerebellum. Number 4, contains autonomic centers regulating heart rate, respiration, and other visceral activities. Our answer is the medulla oblongata. Number 5, it is the large fiber tract connecting the cerebral hemispheres. Our answer is the corpus callosum. Number 6, part of the endocrine system. Our answer is pituitary gland. Number 7, canal that connects the third and fourth ventricles. Our answer is cerebral aqueduct. Last is the number 8. The intermediate mass is part of it. Our answer is thalamus. So, that's all for my part. Again, I am Crisame F. Lardera, and now I will be given the floor to Miss Giaman.
Good day everyone, I am Johara Gerel Gaman and I am going to discuss our answers from meninges of the brain to the spinal cords and spinal nerves. But first, I will explain to you why trauma to the base of the brain is often much more dangerous than trauma to the frontal lobes. Our answer is, the base of the brain is more dangerous than trauma to frontal lobes because it contains the center more vital to life such as respiratory, cardiac, and vasomotor centers. The meninges of the brain. Number 8. Identify the meningeal or associated structures described below. It is the outermost layer, the fibrous connective tissue. It is the dura mater, innermost vascular layer covering the brain and follows every convolution. It is the pia mater, drains cerebrospinal fluid into the venous blood in the dural venous stenosis. It is the arachnoid villi, structure that forms the cerebrospinal fluid is the choroid plexus. Middle layer, or delicate with cottony fibers, it is the arachnoid mater, a dural fold that attaches the cerebrum to the crista galli of the skull. It is the falx cerebri. So now I am going to indicate the path of cerebrospinal fluid from its formation site. From the lateral ventricle to the third ventricle, to the cerebral aqueduct, to the fourth ventricle, to the central canal or spinal cord, to the subarachnoid space surrounding the brain and cord, to the arachnoid villi, to the superior sagittal sinus containing venous blood. Number 10. On the accompanying diagram, label correctly the structures involved with circulation of cerebrospinal fluid. So, on the right side, we have the first lateral ventricles, third ventricle, cerebral aqueduct, and medial and lateral apertures. On the left side, you have the fourth ventricle. So next, we have the cranial nerves. Number 11, using the following terms, correctly identify all structures indicated by letter lines on the diagram. On the upper center, we have the longitudinal fissure. On the left side, we have the frontal lobe of cerebral hemisphere, pituitary gland, temporal lobe of cerebral hemisphere, mammillary body, cerebral peduncle, pons, cerebellum, medulla oblongata, and spinal cord. On the right side, we have the olfactory bulb, optic nerve 2, optic chiasma, optic chalk, oculomotor nerve 3, trochlear nerve 4, trigeminal nerve 5, abducens nerve 6, facial nerve 7, vestibulocochlear nerve 8, glossopharyngeal nerve 9, vagus nerve 10, accessory nerve 11, and hypoglossal nerve 12. Number 12, using choices from the key, provide the name and number of the cranial nerves involved in each of the following activities, sensations, or disorders. Number 1, smelling a flower, olfactory, slowing of the heart, vagus, chewing food, trigeminal, reading the newspaper, optic, feeling a toothache, trigeminal, tasting well-seasoned food, facial, listening to music, vestibulocochlear, rotating the head, accessory, raising the eyelids, oculomotor.
Good day everyone, I am Shanin G. Ibanez. Today, I will be presenting the part 3 which is the spinal cords and the spinal nerves. Anatomy of the spinal cord. Number 1. Complete the following statements by inserting the proper anatomical terms in the answer blanks. The superior boundary of the spinal cord is at the level of the foramen magnum of the skull, and its inferior boundary is at the level of vertebra, and our answer is second sacral vertebra. The collection of the spinal nerves traveling in the vertebral canal below the terminus of the spinal cord is called the cauda equina. For the number 2, using the terms, identify the diagram with structures provided with leader lines. First, we have our dorsal root of spinal nerve, ventral or anterior horn, pia mater, arachnoid mater, dura mater, central canal, white mater, dorsal or posterior horn, lateral horn, ventral root of spinal nerve, and we have our spinal nerve, dorsal root ganglion, dorsal ramus of spinal nerve, ventral ramus of spinal nerve. For the number 3, the spinal cord is enlarged in two regions, the cervical and the lumbar regions. Next, what is the significance of these enlargements? It is to accommodate the greater number of nerve cells and connections needed to process information related to the upper and lower limbs. Spinal nerves and nerve plexuses. Number 4. In the human, there are 31 pairs of spinal nerves named according to the region of vertebral column where they originate. The spinal nerves are named below. Note by number the vertebral level at which they emerge. For the cervical nerves, from C1 to C7. Lumbar nerves, L1 to L5. Sacral nerves, from S1 to S5. Thoracic nerves, from T1 to T12. Number 5. The ventral rami of spinal nerves C1 through T1 and T12 through S4 form plexus, which serves the limbs and anterior trunk of the body. The ventral rami of T2 through T12 run between the ribs to serve the intercostal muscles. The dorsal rami of the spinal nerves serve posterior trunk. For the number 6, what would happen if the following structures were damaged or transected? For the dorsal root of spinal nerve, loss of sensory function. Number 2, ventral root of spinal nerve, loss of motor function. Number 3, ventral ramus of spinal nerve, loss of both motor and sensory function. Number 7, define plexus. Plexus is a complex network of nerves. It is a bundle of intersecting nerves, blood vessels, or lymphatic vessels in the human body. These bundles typically originate from the same anatomical area and serve specific areas of the body. Number 8. Name the major nerves that serve the following body areas. Number 1. Deltoid muscles. Axillary nerve. Number 2. Diaphragm. Phrenic nerve. Number 3. Posterior thigh. Sciatic nerve. Number 4. Lateral leg and foot. Tibial and common fibular nerves. Number 5. Flexor muscles of forearm and some hand muscles. Median and ulnar nerve. Number 6. Flexor muscles of arm. Musculocutaneous nerve. Number 7. Lower abdomen and anterior thigh. Lumbar plexus and femoral nerve. Number 8. Triceps muscles. Radial nerve. Number 9. Posterior leg and foot. Tibial nerve. Part 4. Human reflex physiology. The reflex arc. Number 1. Define reflex. It is a rapid and predictable involuntary response to a stimulus. They are mediated over neural pathways called reflex arcs. Number 2, name 5 essential components of a reflex arc. First is the receptor. Next, sensory neuron. The third one, integration center. Fourth, motor neuron. And the last one is the effector. Number 3, in general, what is the importance of reflex testing in a routine physical termination? Reflex testing is an important diagnostic technique for determining the health of the nervous system. Distorted, exaggerated, or missing reflex response may suggest nervous system degeneration or dysfunction, sometimes before other symptoms appear. Somatic and autonomic reflexes. Number 4, reflexes classified as somatic reflexes include gag reflex, Achilles reflex, corneal reflex, and plantar reflex. Of these, the simple stretch reflexes are patellar reflex and Achilles reflex, and the superficial cord reflex is plantar reflex. A reflex classified as an autonomic reflex is the pupillary light reflex. For the number 5, name 2 cord-mediated reflexes, the patellar reflex and the cross extensor reflex. Name 1 somatic reflex in which the higher brain centers participate. Our answer is superficial cord reflexes. Number 6, trace the reflex arc, naming efferent and afferent nerves, receptors, and integration centers for the following reflexes. Number 1, patellar reflex. Hit patellar tendon to excite the muscle spindles of quadriceps. Femoral nerve. Afferent nerve to integration centers. L2 through L4, from there to efferent nerve femoral back to quads. Effector to make the contraction. Also sends impulse to hamstring. Effector to provide resistance. Number 2, calcaneal tendon reflex. Hit calcaneal tendon, goes to CNS through the sciatic nerve. Afferent, from there it travels to interneurons in the spinal cord. Integration center, S1 through S2. From there to alpha motor neurons, efferent nerve, tibial nerve, from the sciatic nerve to go to the gastrocnemius effector. Number 7, what was the effect of muscle fatigue on your ability to produce the patellar reflex? The intensity of the response was less. Number 8, the pupillary light reflex and corneal reflex illustrate the purposeful nature of reflex activity. Describe the protective aspect of each. First, we have our pupillary light reflex. It protects retina. Corneal reflex. It protects the eyeball from the damage. Number 9 was the pupillary consensual reflex, a contralateral or ipsilateral response. It is a contralateral. Why would such response be significant value in this particular reflex? It helps to even out the light rays, making it less stressful in the affected eye. Number 10, differentiate between the types of effectors used by the somatic and autonomic reflexes, and the types of activities accomplished by the somatic and autonomic reflex. Somatic includes all pathways that are voluntary, and autonomic includes all pathways that are involuntary actions.
I'm Alian Gatsin Lupatan, and now let's proceed to the special senses, the eye and vision anatomy. Number 1. Several accessory eye structures contribute to the formation of tears and or help lubricate the eyeball. Match the described accessory structure with their secretion by choosing answers from the key. Number 1. Mucus. Its match secretion is conjunctiva. Number 2. Oil. Its match secretion is tarsal glands. Number 1.3. Salt solution. Its match secretion is lacrimal glands. Number 2. The eyeball is wrapped in adipose tissue within the orbit. What is the function of the adipose tissue? To pack, protect, and cushion the eyeball in the bony orbit. Number 3. Why may it be necessary to blow one's nose after crying? Because tears drain into the nasal cavity via the nasolacrimal ducts. Number 4. What is a stye? A stye is a painful red bump on the edge of your eyelid. It is formed when the tiny oily producing gland in your eyelash follicle or eyelid skin becomes blocked and gets infected. What is a conjunctivitis? A conjunctivitis is the inflammation of infection of the transparent membrane that lines your eyelid and eyeball. Number 5. Which 7 bones form the bony orbit? Maxilla, zygomatic bone, lacrimal bone, palatine bone, frontal bone, ethmoid bone, and sphenoid bone. Number 6. Identify the lettered structure on the diagram by matching each letter which one of the terms listed below. Letter A. Cornea. Letter B. Anterior segment containing aqueous humor. Letter C. Ciliary zonal are the suspensory ligaments. Letter D. Ciliary body. Letter E. Ganglion cells or ganglion cells. Letter F. Bipolar cells. Letter G is photoreceptors. Letter I is iris. Letter J is ciliary venous sinus. Letter K is lens. Letter L is choroid. Letter M is vitreous humor and posterior segment. Letter N is sclera. Letter O is retina. Letter P is optic disc. And letter R is optic nerve. Number 7. Match the key responses with the descriptive statement that follows. Number 7.1. Attach the lens to the ciliary body. Ciliary zonal. Number 2. Fluid filling the anterior segment of the eye. Aqueous humor. Number 3. The blind spot. Optic disc. Number 4. Contains muscle that controls the size of the pupil. Iris. Number 7.5. Drains the aqueous humor from the eye. Canal of Schillem. Number 7.6. Layer containing rods and cones. Retina. Number 7.7. Substance occupying the posterior segment of the eyeball. Vitreous humor. Number 8. Forms most of the pigmented vascular layer. Choroid. Number 7.9. Tiny pit contains only cones. Fovea centralis. Number 10. Important light bending structure of the eye shape can be modified. Lens. Number 11 or 7.11. Anterior transparent part of the fibrous layer, your window on the world. Cornea. Number 12. The white of the eye. Sclera. Number 8. The intrinsic eye muscle are under the control of which of the following? Autonomic nervous system or somatic nervous system? The answer is autonomic nervous system. Next reporter.
So, hello, my name is Christian J. Aore and I am going to discuss the visual tests and experiments. For number 11, use terms from the keys to complete the statement concerning near and distance vision. Some terms may be used more than once. Excuse me. For during distance vision, the ciliary muscle is relaxed. The ciliary zonial, which is the suspensory ligament, is taut. Then the convexity of the lens is decreased, and the light refraction is decreased. During the vision, the ciliary muscle is relaxed. Is contracted. Sorry, the muscle is contracted. Then the ciliary zonial or suspensory ligament is relaxed, while the lens convexity is increased, while the light refraction is still increased. For number 12, explain why the part of the image hitting the blind spot is not seen. It is because there are no photoceptors. For number 13, matching the terms in column B with the description in column A. So, for number 1 is light bending, which is refraction. For number 2, we have ability to focus for close under 20 feet vision, which is accommodation. For number 3, we have the emetropia, which is normal vision. For number 4, we have inability to focus well on close objects, which is farsightedness, is hyperopia. And for nearsightedness is myopia. Myopia. I'm sorry. For number 6, blurred vision due to unequal curvatures of the lens or cornea, which is astigmatism. And for number 7, we have the medial movement of the eyes during focus on closed objects, which is convergence. So let's continue to the next part, which is the number 20, the ear in the hearing and balance of anatomy. So for select the terms from the column B that applies to column A description. Some terms are used more than once. So for the blank one, we have the hammer or malleus. Then we have the anvil, intus, and stirrup, which is tapes. For collectively called auditory, so we have semicircular canals and vestibule. For number 3, you have tympanic membrane. For number 4, we have semicircular canals. For number 5, we have oval window. For number 6, we have pharyngon tympanic auditory tube. For number 7, we have the endolymph, and for number 8, we have the pharyngotympanic auditory tube. So for number 21, which is the indication of structures of the ear region. So as we can see in the description below, so here are the illustration of the ears, which has the pinna. We have the inner ear, middle ear, the tympanic membrane, and we have the semicircular canals, the vestibule, the vestibulocornea nerve. We have the oval window, we have collia, round window, auditory tube, stirrup, anvil, hammer, outer ear, and auditory ossicles. So, as the description says, so continuing each, as the outer ear is this visible and external portion of the ear on the side of the head, which consists of the pinna, external acoustic meatus, and tympanic membrane. Then we have the pinna. The auricle or pinna catches amplifies the funnel sound waves down to the ear canal to the eardrums. Then we have the external acoustic meatus, which is also known as the ear canal. It serves as an entryway for sound waves towards the eardrum. And we have the tympanic membrane, also known as the eardrum. It separates the outer and the middle ear. Then the stirrup, also referred as tapes, anvil, also called the incus, hammer, also known as the malleus, and oval window, it is opening for the middle ear that stimulates the auditory fluids in the inner ear. So let's continue to the next part, which is matching A to B. We have matching type. So Match the membranous labyrinth structures listed in column B with the descriptive statement in column A. Some terms are used more than once. So column A, we have the cochlear duct. For number 2, we have the utricle saccule. Number 3, we have the basilar membrane. For number 4, we have pictorial membrane. For number 5, we have the ampulla saccule otoliths. Then for number 6 is we have utricle, ampulla, copula, semicircular ducts. For number 7, which is the fluid contained within the membranous membrane, is we have vestibular nerve. For number 8 is we have cochlear nerve, and number 9, copula and otoliths. So for number 23, describe how sound of different frequency pitch are different in the cochlea. So it is different because the pitch sound stimulates different areas in the spiral organ. And for number 24, explain the role of the endolymph of the semicircular canals in activating the receptors during the angular motion. So since the endolymph travels more slowly than the copula, it bends, activating the receptors. Then wait. Then number 25, explain the role of the otoliths of static equilibrium head position. So when the head moves, otoliths moves in response to variation in gravitational pull. As they deflect different hair cells, they hyperpolarize or depolarize hair cells and modify the rate of impulse transmission along the vestibular nerves. Then let's continue to the next chapter, which is the chemical senses, location and anatomy of olfactory and taste receptors. So for number 23 is describe the cellular makeup and the location of the olfactory epithelium. So for number 33, the olfactory epithelium occupies a 5 centimeter squared area in the roof of the nasal cavity, which is the olfactory epithelium's cellular makeup is made up to approximately 10 million olfactory neurons and axons of these bipolar neurons. And for number 34, name 3 sites where receptors for taste are found and circle the predominant site. So for number 34, we have the epiglottis and pharynx, epiglottis and soft palate. So for number 35, describe the cellular makeup and arrange of a taste bud. Use a diagram if helpful. So number 35 is gustatory cells, basal cells, and supporting cells are the 3 basic type of specialized epithelial cells that makes up the taste bud. Cellular makeup, the following are arrangements on the border between the anterior and posterior parts of the tongue. So the valleate, there are V-shaped row on the fold and on the side of the tongue, so scattered unevenly across the whole tongue surface. For number 36 is the taste and smell experiments. So taste and smell receptors are both classified as a chemoreceptors and a chemical in the solution because they both respond to chemical in the solution. For number 37, why is it impossible to taste substances if the tongue is dry? It is because the taste don't enter the taste pores as they dissolve in saliva. Taste pores depolarize as a result of this mechanism. This aids in the way we process taste, since without saliva, the initial stage of taste processing are not triggered. As for number 38, name three factors that influence our appreciation of food. Substantiate each choice with examples from the laboratory experience. So 38 is we have taste, smell, and touch. We can't taste if we can't smell, so smell has a strong influence on our appreciation. And for number 38.2, we can't taste if we can't smell, so smell would have a significant impact on our appreciation. And for the 38.3, we have the touch, which is perception is aided by touch, a matter of taste. This aids in sensory processing information about what we eat. Then for number 38.4, expand on your explanation and choices by explaining why a cold greasy hamburger is unappetizing to most people. So a cold greasy hamburger is unappetizing to most people because it can interfere with the taste buds, the ability to function, and won't be able as good as a warm hamburger. So without being able to taste the hamburger, you will only feel a coldness in your mouth. Second, the cold grease cannot be readily dissolved, so it will appear unappetizing. So for the last number is how palatable is food when you eat cold. So food is less palatable when you have a cold because your nose is blocked up and you cannot smell the food. The smell of food is a big factor affecting your perception of the flavor when you have a cold. Most of foods taste rather bland because you cannot smell them. So that is my discussion about the worksheet number 6 in nervous plus special senses. So that's it. Thank you.